Georgia-AIMH is really an interdisciplinary organization whose members come from many sectors of the infant early childhood workforce. For example, we have behavioral health members, early care and education, health home visitors, early interventionists, and policy and research. And the members really will receive ongoing professional development to serve the specialized needs of babies, young children, and families. And by really securing the infant early childhood mental health endorsements.
Georgia-AIMH is an organization that is their primary purpose is to advocate, educate the community around the issue of infant and early childhood mental health in our state. It's a membership organization, and we are working really hard on modifying legislation and getting services paid for and getting the word out about the importance of protecting children or the mental health of infants and early children in their early years.
The Georgia Association for Infant Mental Health will support a range of early childhood professionals who really work with children where they are. So we're thinking about early childhood educators, home visitors, folks in pediatricians' offices, and then clinicians, therapists who are working with young children and their families. The mission of Georgia-AIMH, which is what we call the association, is to promote family, infant, and early childhood mental health as foundational to development by raising awareness of young children's social and emotional needs, building culturally responsive, preventative, and therapeutic professional capacities, fostering interdisciplinary and cross-system collaboration by supporting professionals working with and on behalf of infants, young children, and their families, and of course, advocating for and supporting policies in the best interests of infants, young children, families, and communities. The association will be responsible for endorsing professionals that show that they have gone above and beyond their own profession's licensure to really focus on the needs of infants, young children, and families, and also to bring trainings to the state to help grow and support this workforce.
We have had a number of fast-moving activities. For example, we offered child-parent psychotherapy opportunities for clinicians in Northeast Georgia. We also provided DC 0 to 3 training, which is diagnostic training for clinicians. We have offered, as I mentioned, we established our Georgia-AIMH Advisory Council, and we have met with the Alliance for the Advancement of Infant and Early Childhood with the higher education representatives to review the endorsement process, which includes promotion, prevention, treatment, intervention, leadership for those persons in the mental health and various disciplines around where they can best improve and enhance their skills with the endorsement.
Georgia-AIMH has been very busy. We started out as an exploratory board, and over the course of the year, we were able to actually get an association formed. We have identified funding to pay for many of the services and some of the training. We had an initial CPP training where we brought in clinicians from around the state to be trained to use an evidence-based model to work with the parent-child dyad and to kind of help children who've experienced at least one trauma. We have found a home at Georgia State University. We have done a lot of work this year.
Georgia-AIMH is a relatively new organization that is housed at Georgia State University. Over the last year, Georgia-AIMH has been working to identify opportunities to help grow the workforce that will support young children and families. In particular, Georgia-AIM has partnered with the Department of Early Care and Learning and the Department of Public Health here in Georgia to support training for child parent psychotherapy, which is a therapeutic intervention for families that works specifically with the caretaker and the child on that attachment that we know is so critical to lifelong mental well-being. So starting in early childhood, clinicians can work with families to support that attachment. And right now in Georgia, we really don't have a large range of professionals who can support very young children. So the association will be working to grow that workforce. Additionally, Georgia-AIM has been working to create a suite of trainings for professionals to focus on really what we consider the foundations of infant and early childhood mental health, as well as the diversity-informed tenets of this work. And this will really support professionals who aren't necessarily in that clinical space, but who are working really closely with young children. So again, thinking about early childhood educators, folks who work in our early intervention spaces, and this will support families across sort of the spectrum of what we would consider promotion, prevention, intervention, and treatment. So able to reach families really where they are with the types of supports that they need to help support the social emotional development of young children.